Why medication isn't enough to treat addiction. With prescription drugs, it's possible to make withdrawal symptoms easier to deal with, keeping people healthy, as comfortable as possible during this critical stage of addiction treatment. Medication can also help people taper down their use of drugs like heroin, keeping them safe from overdoses, drugs that have been tampered with, and other dangers. But is it enough? I'm Jeremy Arts, a licensed marriage and family therapist who helped build the programs here at the Edge Treatment Center. Our center takes a holistic approach to drug rehab, meaning we don't just treat the immediate symptoms of addiction, but the person as a whole. Medications play a big role in how we treat addiction, but it's a role that only goes so far. And here's why. How medications help treat addiction. Treating the symptoms of drug addiction is important. Take drug detox. It's the first step in treating addiction, but it's also incredibly difficult to go through. See, when a person uses drugs for a length of time, their body gets used to them. When those drugs leave a person's body, their body goes into shock, making the person feel sick. This is drug withdrawal, and it can be an unpleasant and even dangerous step when you're doing it on your own. Medications can make this part of recovery less difficult, far safer. Here's another way medication helps treat addiction. At the Edge, we're big believers in medication-assisted treatment. This is a form of treatment that uses FDA-approved prescription drugs to help people taper themselves off from dangerous opioids like fentanyl and heroin. Drugs like buprenorphine and Suboxone act like other opioids, but don't cause the euphoric effect. They allow a person to slowly taper off from opioids, avoid drug cravings and overdoses, and be more present in their recovery. This is fantastic. I've seen the differences these prescription medications have made for people struggling with addiction. But I also know that medication isn't enough to treat addiction. There's some things medication can't do. Drug addiction is about taking drug, but it's also about the why people get into drug addiction. Medications, great for treating the physical side effect of addiction, but the mental side requires a somewhat different approach. As a disease, drug addiction often has very complex roots. Drug addiction can start as a way to self-medicate for past traumas, like childhood abuse. Drug abuse can also result from mental disorders, which are also complex medical conditions that require a holistic approach to treat. As useful as medications are at treating symptoms, they can't really help a person explore why they're using drugs in the first place. Drug addiction often occurs along with mental disorders like depression and anxiety. In our field, we call this a dual diagnosis. While there's certainly a role for medication to play in dual diagnosis treatment, like antidepressants, for example, medications can't help a person change their mindset and find new coping mechanisms like talk therapy can. Let me be clear. Medications play a very important role in recovery, but they can't do the job alone. It takes both medications and a devoted professional support network to help a person reach recovery and thrive. Here at The Edge, we work with you to make sure all of your recovery needs are met. Our holistic approach will help you build a life worth living using the latest addiction medicine along with proven treatment approaches like medication-assisted treatment. We'll help you leave addiction behind. Reach out to us today to learn more. Thanks for watching our video. See you next time.